It's time for a breakthrough in the fight against germ warfare. Clinikill, intelligent surfaces, 24/7. Within public places such as hospitals, aged and childcare facilities, airport terminals, food halls, and even the hotels and motels we frequent, we want comfortable and hygienic environments. However, we are constantly surrounded by billions of microorganisms. While the majority are harmless, there are some that can cause illness or even death, and they can be in some of the most unexpected places.
People do a pretty good job of trying to control germs and bacteria in various public places, like food outlets, public toilets or hospitals. It is important to pay particular attention to where bacteria thrive and multiply. This includes bench tops, door handles, cupboard doors, wall areas, handrails, bed frames, kitchen cabinets, toilets, bathrooms and agricultural surfaces, such as in cow sheds and abattoirs. Germs will rapidly multiply on surfaces that have no antimicrobial activity, and they can be easily transferred from person to person by contact, either by food, cleaning tools, personal contact, sneezing or coughing. To prevent germs from multiplying on surfaces, Australasia's leading powder coating specialist, Dulux and Orica powder coatings, has developed a new powder coating product, Clinikill. Clinikill contains nature's antimicrobial agent, silver irons. The protective powder coating releases the silver iron that kills germs and prevents them multiplying and causing infections.
Interesting statistics from a New Zealand Ministry of Health report show that 495 contagious diseases outbreaks were reported in 2006, an increase of 36% over the previous 5-year average. 9 deaths were related to contagious diseases outbreaks, with 8 of these residents of rest homes or hospital patients. Various control measures were undertaken as a result of these outbreaks and included cleaning and disinfection 28% of the time, closure 6% of the time. Clinikill will assist in reducing the frequency of outbreaks and the costly measures associated with them, such as cleaning, disinfection, and even closure. So let's see how it works in detail. The Clinikill powder coating can be used on surfaces such as walls, furniture, door handles, handrails, beds and equipment, in kitchens, bathrooms, agricultural surfaces such as in cow sheds and abattoirs, and other areas and facilities such as hospitals, rest homes and childcare centres. The powder incorporates cuboid ceramic blocks known as zeolite, which contain silver ions. If the microorganisms come into contact with the zeolite blocks, the silver ions are released and attack the bacteria, rendering them harmless in 3 ways. Firstly, the silver ions attach themselves to the outer wall and cut off the oxygen supply to the microorganism, which causes it to die. Secondly, the silver ions penetrate the cell wall and enter the interior of the cell, blocking the metabolic process, and the bacteria quickly dies. The third mechanism disrupts the rapid multiplication of the bacteria, stopping the microorganism duplicating every 20 minutes, and the microorganism cell dies. The additive containing the silver ions, which is incorporated in Clinikill, has been approved by the US FDA and the US EPA as a food contact product. The silver ions, which are evenly distributed on the surface and throughout the powder coating film, provide an invisible protective layer, killing germs and preventing their rapid multiplication 24 hours a day, 7 days a week, 365 days a year, and so on throughout the life of the coating on the surface. Since silver ions only affect the simplest life forms, such as bacteria, humans are not adversely affected and they do not alter foodstuffs. The antimicrobial effect of silver has been known about for hundreds of years. As early as the 11th century, silver chalices were used for water or wine to prevent infections being spread through shared use in common rooms or dining halls. As silver is an inorganic material, microorganisms cannot build up immunity to it, unlike widely used antibiotics. Clinikill has proved effective against one of the most high-profile antibiotic-resistant bacteria, MRSA, methicillin-resistant Staphylococcus aureus, that has caused a number of outbreaks in hospitals. Research by Orica Powder and Industrial Coatings Limited focused on ensuring that the silver ions are evenly distributed throughout the powder coating so they can be released over a long period of time and to give maximum antimicrobial protection across a wide variety of surfaces. This is achieved by our innovative kinetic manufacturing process. While it's important that the silver ions are on the surface so they come into contact with the bacteria and kill them, it is also important for them to be evenly distributed below the surface. So if the surface is damaged, they are still effective. We can see images of the structure of the cuboid silver containing zeolite crystals. The outcome of the kinetic process, which ensures even distribution of the silver ions throughout the powder particles, which then allows an even distribution of the silver ions on the surface and throughout the powder coating film that is covering the article.
Extensive testing has confirmed that we have achieved the optimum distribution of the silver ions in Clinikill, and it can be confidently used on a vast array of surfaces that can be powder coated, including steel, aluminium, various alloys, wood composites and plastic. Testing by a globally accredited laboratory in Japan confirms that Clinikill meets the globally recognized standard for measuring antimicrobial activity, JIS Z2801. A range of different bacteria was deliberately introduced to test specimens from a range of surfaces powder coated with the Clinikill product. In the case of the tests of untreated surfaces, clear bacteria growth can be seen. Where the Clinikill products were used, there was no growth. What we would like to see more in the future is the use of less cleaning agents, as surfaces become more self-disinfecting with Clinikill.
If we concentrate on the surfaces that are most at risk from the growth of microorganisms and use Clinikill technology, we can play a part in significantly reducing risks to people's health and well-being. The technology will also reduce the cost of outbreaks, which result in extensive cleaning regimes, closures, and unnecessary suffering and potentially death. It's time to make the change and prepare for the future with Clinikill Intelligent Surfaces 24/7.